Hello and welcome to Back to the Science. I'm Dr. Susan Oliver and I'm a scientist. This video is part 2 of what is currently a 2-part series looking at 2 recent ivermectin studies out of Brazil that had very different conclusions. These are the 2 studies. The first study was an observational study that claimed to show that taking ivermectin as prophylaxis for COVID is beneficial. The second study, which is part of the Together trial, is a double-blind, randomised, placebo-controlled trial that showed there was no benefit in taking ivermectin for COVID. In part 1, we discussed the first study in detail. If you missed it, I'll put a link in the video's description. But in summary, it is a study that tells us nothing about ivermectin. Most of the people who were purported to be taking ivermectin actually weren't for most of the study. We have no idea how many people enrolled in the study were still living in the city at the end of the study, and the study ignored or didn't correctly record key confounders. In this video, we'll be looking at the second study, the Together trial, and in particular, addressing some of the criticisms of it. The Together trial was recently published in the New England Journal of Medicine, and it is a platform trial, which basically means that the same study protocol was used to evaluate multiple medications against a placebo arm. It was also adaptive, which means that different medications could be introduced at different times. And they worked with the local public health authorities from 12 cities in Brazil. It was also double-blinded, which means that neither the trial participants nor the clinicians involved knew who was getting medication versus placebo. They recruited 10,467 patients who were assessed for eligibility. 6,900 of those were excluded because they didn't meet the inclusion criteria, leaving 3,515 who underwent randomisation. People were either randomised to ivermectin, 400 micrograms per kilogram for 3 days, placebo, or a different treatment. And 400 micrograms is the same as 0.4 milligrams. And there were 679 assigned to the ivermectin arm and 679 assigned to the placebo arm, which makes it the biggest randomised trial for ivermectin so far published. You'll note that one of the other treatments was ivermectin at 400 micrograms per kilogram for 1 day. This particular arm was discontinued and the dose duration increased to 3 days after criticism from ivermectin advocacy groups. The reason they initially used 1 day is because it is normally only given for 1 day when used to treat parasites. Now, the primary outcome of the trial was a composite measure of hospitalisation for COVID or observation in an emergency department for at least 6 hours. And the reason they chose this composite instead of just hospitalisation is because hospital overcrowding at certain stages during the pandemic meant that some people who should have been admitted to hospital weren't, and instead were just kept under observation in the hospital. So, what did they find? The results were analysed 3 ways. Firstly, they did an intention to treat analysis, which means they included everyone who was randomised to ivermectin or placebo. And here they found 14.7% of patients in the ivermectin group and 16.3% in the placebo group met the primary outcome. This is a relative risk of 0.9. But as you can see, the 95% Bayesian credible interval includes 1. So the difference isn't statistically significant. They next did a modified intention to treat analysis where they excluded anyone who had had an event less than 24 hours after randomisation. In this case, the relative risk was 0.89, which again was not statistically significant. Finally, they did a per protocol analysis, which only included those who reported 100% adherence to treatment and only included those who were in the placebo group that had had 3 tablets. As different treatments were tested in the study, different people were assigned to a different number of placebo tablets, depending on the comparator. For this analysis, the relative risk was 0.94 and You guessed it, the difference wasn't statistically significant. They also looked at a number of secondary endpoints, but none of these showed a statistically significant difference either. One outcome that I found particularly interesting was viral load. As you probably know, there are quite a large number of proposed mechanisms for how ivermectin supposedly works in COVID. Quite a lot of these are mechanisms by which it could reduce viral load. As you can see from this figure, ivermectin has no effect on viral load whatsoever. So that's a study in a nutshell. As expected, ivermectin fans are not happy with the study and have come up with a variety of criticisms, although some so far are pretty much just choosing to ignore it as they've done for other randomised trials that don't show a benefit for ivermectin. In the rest of this video, we'll have a look at some of these criticisms. The first criticism of the study is a rather vague, the study was designed to fail because some of the authors have connections to organisations that have connections to Pfizer. And some of the people making this claim are the same people who are making money advocating for ivermectin and failed to disclose this in the other paper out of Brazil, which we discussed in part 1. These are the same people who claim that ivermectin is a miracle product. If it's such a miracle product, how can you design a trial to show it fails? And if the trial authors were trying to design the trial to fail, supposedly to keep Pfizer happy, why didn't they design the fluvoxamine arm of the Together trial to fail as well? Fluvoxamine with the same endpoint as ivermectin showed a statistically significant 30% improvement compared with placebo. The next criticism is that they didn't treat early enough because trial participants could start treatment up to 7 days after symptom onset. That's right, this miracle treatment apparently only works if you take it within a few days of symptom onset. Which makes me wonder why ivermectin is included in the FLCCC protocol for hospitalised patients if it supposedly only works now if it's given early. Anyway, it turns out that this criticism is actually directly addressed in the manuscript. This figure shows a number of subgroup analyses that were done. If you look at the bottom of the figure, you can see that they compared those who received ivermectin in the first 3 days with those who received it at 4 to 7 days. And as you can see, those who got it early actually fared worse than those who took placebo. Now, this difference isn't statistically significant, so it's not actually saying that taking ivermectin early causes harm, but it's clear that taking ivermectin early offers no greater benefit than taking it later. Another criticism is that the dose was too low and or it wasn't given for long enough. I find this rather amusing because the exact opposite argument was used for hydroxychloroquine. We were told by hydroxychloroquine fans that the trials failed because they used higher than the approved dose, and it would have shown a benefit if only they had used the approved dose. Of course, when the approved dose also failed, they had to come up with another excuse, and I can't quite remember what that actually is at the moment. And of course, ivermectin fans regularly tout trials with lower doses as evidence that ivermectin works. In part 1 of this video series, we discussed the other study out of Brazil that was undertaken in Itajai. Ivermectin fans are happy to point to this study as evidence that ivermectin works, even though the dose given was only 0.2 milligrams per kilogram of body weight for 2 days, which is both a lower dose and shorter time than the Together trial. You can't have it both ways. One of the most vocal proponents of ivermectin is the FLCCC, who have been advocating the use of ivermectin for quite some time. Interestingly, when they first started recommending ivermectin, their recommended dosage was 0.2 milligrams per kilogram of body weight for 2 days, which is much lower than the dose used in the Together trial. And at the time the Together trial commenced the ivermectin arm, their recommended dosage was 0.3 milligrams per kilogram of body weight for 5 days, which is a lower dose than in the Together trial, but a longer duration. And at both of these times, the claim was that ivermectin was making a huge difference. Now, using higher doses in the Together trial is not enough. The current dose recommended for ivermectin is a range from 0.4 milligrams per kilogram to 0.6 milligrams per kilogram of body weight, which encompasses the dose used in the Together trial, although the FLCCC recommendation is for a higher duration of 5 days instead of 3 days, unless they recover within 3 days. We are told that this new dosage regime is the magic dose, but really, how would they know? The FLCCC Mask Plus protocol includes everything but the kitchen sink, including some medications that have shown a benefit for COVID, like fluvoxamine and melatonin. It's impossible to determine if ivermectin is making a difference unless you perform a randomised trial with and without it. Indeed, the FLCCC previously thought that an earlier version of their protocol reduced the death rate amongst hospitalised patients to 6.1% compared with mortality rates reported in the literature ranging from 15.6% to 32%, which sounds pretty impressive. Only problem, it wasn't true. The hospital where the trial took place checked their records, and it turned out that the mortality rate amongst the patients who received all 4 of the protocol therapies was actually 28%, just a bit more than 6%. And that's why the paper has now been retracted. Now, just to be clear, this trial was done before ivermectin was added to the protocol, so it's not directly relevant to ivermectin. But what it does show is that the FLCCC can sometimes see what they want to see and think something is working when it actually isn't. And that's one of the reasons that doctors are blinded in trials as well as patients. Regarding the length of treatment, this has already been addressed by the authors of the Together trial in the appendix. They state that most events in the trial occurred within the first 5 days post-randomisation, and that ivermectin has a prolonged systemic half-life of 18 hours and longer residence times in tissues. This means that there is still substantial systemic ivermectin at the time that events occurred. And this figure shows a model plasma concentration. You can see that the plasma level at 96 hours is very similar to the plasma level at 24 hours. Also, it's worth mentioning that the Itajai trial in Malaysia did continue dosing for 5 days, and they also didn't find a significant difference between ivermectin and no treatment for any of their endpoints. Ivermectin was also given on a full stomach in the Itajai trial, which was another criticism of the Together trial. The Itajai trial showed that this also wasn't enough to see a benefit from ivermectin. What next? Oh yes, some are claiming that the trial is invalid because it is a platform trial, and that means that some of the placebo arm could have been exposed to different variants than those in the ivermectin arm owing to the timing. Now, this would be a valid criticism, except that the per protocol analysis only included those people who got the 3-day placebo, which was given at the same time as the ivermectin arm. And as I presented earlier, there was only a 6% difference between the 2 arms for this analysis. A rather strange claim is that the people in the placebo arm were actually taking ivermectin anyway, and they never checked for this in the study. A quick read of the discussion shows that this is rubbish. Let me read it for you. We ensured that trial participants did not have a history of ivermectin use for the treatment of COVID-19 by means of extensive screening of potential participants about this issue. But even if all trial participants were taking ivermectin, the trial still isn't very impressive for ivermectin because nearly 15% of the placebo group was still either hospitalised or required an extended ER visit, which is what was expected for the placebo group prior to the trial. If ivermectin actually made a difference, this rate should have been lower. The final claim being made is that the Together trial showed a benefit for ivermectin, and people are lying saying that it isn't. I've actually had a few comments here and on Twitter making this claim. The people making this claim are not understanding statistical analysis. It's highly unlikely that two groups would have exactly the same outcomes. Therefore, if results between two groups are different, you have to determine if they are really different or if they are likely to have occurred by chance. And in the case of the Together trial, there is no statistically significant difference between results for placebo and ivermectin for any outcome. Now, some people make the point that if the trial was larger, then the difference would be statistically significant. This is kind of true, but without doing a larger trial, you can't say for sure that the difference would be the same. That's the whole point of doing a bigger trial, to actually get, more people. But more importantly, for the primary outcome, the difference is only between 6 and 11%, depending on how you analyse the data. So even if it was statistically significant, it's not really clinically significant. Finally, some people ignore the primary outcome and instead focus on one of the secondary outcomes, which is hospitalisation for any cause, where the difference between placebo and ivermectin is a bit larger, although still statistically insignificant. What these people are forgetting is that hospitalisation wasn't chosen as the primary outcome because hospital overcrowding in Brazil at certain times during the pandemic meant that people who should have been hospitalised were instead just observed in the ER. And as you can see in this table, this occurred for more people in the ivermectin group than in the placebo group, leading to a corresponding decrease in official hospitalisations. In summary, as with every other well-designed randomised controlled trial for ivermectin, the Together trial showed no benefit in taking ivermectin for COVID. Now, there are still a few more ongoing trials that we don't have results for yet, so it's plausible they could show a small benefit, but it's unlikely to be a large benefit. It's also worth mentioning that if you happen to have a parasite infection at the same time as COVID, ivermectin could be beneficial, but there's no need to take any more than the recommended dose for parasites. If you'd like to look further into the data that I've presented, I've provided links in the video's description. And please remember, this video is about the science, but you shouldn't take it as medical advice. For that, you should speak to your medical practitioner. Thank you for listening. And if you found this video useful, please hit the like button so that more people will see it. Apparently, the YouTube algorithm shows the video to more people if people have hit the like button. So I've heard. And also, if you'd like to see more videos about the science in the future, please hit the subscribe button.